Blood, lymphatic, and immune disorders. Anemia. In anemia, there is a reduction in the number of red blood cells in the body, or the hemoglobin in the red blood cells is deficient or abnormal. Hemoglobin is the component of red blood cells that binds with oxygen in the lungs and carries it through the circulatory system to body tissues. If there are too few red blood cells or their hemoglobin is lacking or abnormal, the oxygen carrying capacity of the blood is reduced and the body tissues may not receive enough oxygen. Normally, stable hemoglobin levels in the blood are maintained by a balance between red blood cell production in the bone marrow and red cell destruction in the spleen. Anemia may result in if this balance is upset or if the hemoglobin is abnormal. There are four main types of anemia. The first is due to a deficiency of substances necessary for the formation of red blood cells. The most common form of this type is iron deficiency anemia. This is a result of low levels of iron in the body and is most common in women who have heavy menstrual bleeding. The second type of anemia results from inherited disorders in which abnormal hemoglobin is produced, such as in sickle cell disease, see below. The third type of anemia, known as hemolytic anemia, occurs when red blood cells are broken down more rapidly than they can be replaced. This may be caused by the body's immune system destroying red blood cells, by certain inherited disorders, or by infections such as malaria. The fourth type of anemia, called aplastic anemia, is caused by failure of the bone marrow to produce enough red blood cells. The underlying cause is often unknown, but it may sometimes be due to toxins, radiation, or certain drugs. Normal blood cells. This color-enhanced light micrograph view of the human blood cells shows the characteristic appearance of healthy normal red blood cells. Round, bright red, and with small pale area in the middle of the cells. Iron deficient red blood cells. This light micrograph shows iron deficient red blood cells. In iron deficiency anemia, the red blood cells are slightly smaller than normal, generally paler overall, and have larger pale area in the centers. Sickle cell disease. Sickle cell disease is an inherited disease in which red blood cells contain abnormal hemoglobin, the substance that carries oxygen to body tissues. This makes the red cells fragile, rigid, and sickle-shaped. The abnormal red cells may be destroyed prematurely, leading to anemia. See above. They may also become lodged in small blood vessels, obstructing blood flow and depriving organs of oxygen. This may lead to episodes of severe pain, sickle cell crisis, and eventual organ damage. The condition is most common in people of African or Afro-Caribbean origin and is caused by abnormal gene. If a child inherits two abnormal genes, one from each parent, he or she will develop sickle cell disease. However, if a child inherits only one abnormal gene, the condition known as sickle cell trait results, which does not usually produce symptoms. Screening for sickle cell disease may be offered in pregnancy or shortly after birth. Treatment is aimed at preventing and treating the crisis with medication, rehydration, or blood transfusions. In some cases, a bone marrow transplant may be an option. Sickle cell disease, red blood cells. In sickle cell disease, some red blood cells are disordered into a sickle shape. These abnormal cells have a reduced lifespan, leading to anemia. Alright, leukemia. Leukemia is a group of cancers in which there is controlled proliferation of abnormal white blood cells in the bone marrow and reduced production of normal blood cells. The cancer's white blood cells are unable to fight infection. Lack of red blood cells lead to anemia, and reduced levels of platelets lead to excessive bruising and bleeding. The cancer's white cells also spread out to other organs. Leukemia may develop rapidly, acute, or more slowly chronic, and may be fatal without treatment, which may include anti-cancer drugs, blood transfusions, radiation therapy, or a bone marrow transplant. Stem cells in the bone marrow, red blood cell, lymphocyte, platelet, fewer platelets, lymphoblasts multiply. Lymphoblasts in bloodstream, fewer red blood cells. Blood cell production. All blood cells derive from stem cells found in the bone marrow. Red blood cells carry oxygen. Lymphocytes are a type of white blood cell that fights infection. Platelets help the blood to clot at injury sites, reducing blood loss. Acute lymphoblastic leukemia. Lymphoblasts, immature malignant lymphocytes, proliferate rapidly in the bone marrow. As a result, the production of normal blood cells is disrupted. Lymphoblasts also spread via the bloodstream and carry the cancer to other tissues and organs in the body. Hypercalcemia. In the normally high level of calcium in the blood is called hypercalcemia. It is commonly caused by overactivity of the parathyroid glands, small glands in the neck that help regulate the blood level of calcium. Cancer may also cause hypercalcemia, either by spreading to the bone or by producing abnormal hormones that cause bones to release calcium. Less commonly, the condition may result from too much vitamin D in the diet or from certain inflammatory conditions such as sarcoidosis, thought to be due to overactivity of the immune system. Lymphangitis. This is an inflammation of lymphatic vessels due to the spread of bacteria from the site of an infection, usually an infected wound. This condition typically affects lymphatic vessels of the arm or leg. The infected vessels become tender and inflamed, and red streaks may appear on the overlying skin. Nearby lymph nodes may also become swollen, and sometimes ulcers form on the skin over the infected lymphatic vessels. If left untreated, the infection may spread into the blood and cause septicemia, which may be life-threatening. Lymphadenopathy, swollen lymph nodes. Lymphadenopathy is an enlargement of the lymph nodes, sometimes called glands, usually due to an infection or to the proliferation of white blood cells within the lymph nodes. A single node, a group of nodes, or sometimes all the lymph nodes may be affected. Swelling of a single node or a group of nodes is often due to localized bacterial infection. For example, swollen lymph nodes in the neck are commonly due to a throat infection, and they usually subside when the infection clears up. Swollen nodes that are due to infection are often painful. Persistent swelling of many or all of the lymph nodes may be the result of some types of cancer, such as breast cancer, leukemia, or lymphoma. Lymphatic system cancer. Swollen nodes due to cancer are not normally painful. Persistent lymph node enlargement may also be caused by long-term infections such as tuberculosis or HIV infection. Armpit axillary nose, neck cervical nose, spleen, groin inguinal nodes, knee popliteal nodes, lymphatic vessel. Lymphatic system. The lymphatic system consists of a network of lymph nodes connected by lymphatic vessels. The nodes generally occur in clusters, mainly in the neck, armpits, and groin. The lymphatic system also includes organs such as the spleen. Lymphedema. In lymphedema, fluid accumulates in the lymphatic vessels, resulting in the painless swelling of the limb. There are various possible causes, including obstruction of the lymphatic vessels by cancer cells or parasitic worms, surgical removal of lymph nodes, or radiation therapy to an area containing lymph nodes may also result in lymphedema. Rarely, it may be due to an inherited condition in which the lymphatic vessels fail to develop properly. In some cases, it occurs for no known reason. Lymphedema is usually a lifelong condition, and treatment is aimed at relieving symptoms. Lymphoma. Lymphomas are cancers that develop when lymphocytes, a type of white blood cell, multiply and form tumors in the lymphatic system. They may also spread to other tissues. There are two main types called Hodgkin's and non-Hodgkin's lymphoma. In Hodgkin's, a particular type of cancer cell is present. All the other types are classed as non-Hodgkin. Hodgkin's most commonly affects those aged 15 to 35 or over 50. The other lymphomas mainly occur in people over 60. The cause is unknown, but they may run in families. They are also more common in those with reduced immunity and may be triggered by certain infections. Mesenteric adenitis. In mesenteric adenitis, the lymph nodes in the mesentery, the membrane that anchors organs to the abdominal wall, become inflamed. The condition most commonly affects children and is usually caused by a viral infection. The main symptoms are pain in the center or lower right side of the abdomen, fever, nausea, and diarrhea. Usually no treatment is needed other than pain relievers, and the condition clears up by itself within a few days. However, a doctor should be consulted to rule out other possible causes of the symptoms, such as appendicitis. HIV and AIDS. HIV, human immunodeficiency virus, gradually destroys cells of the immune system and may eventually lead to AIDS, acquired immunodeficiency syndrome, a life-threatening condition. HIV is passed on by contact with infected body fluids, including blood, semen, vaginal fluids, and breast milk. It can also be passed on from an infected woman to her fetus or to the baby at birth. Initially, there may be a short flu-like illness, mouth ulcers, or rash, or no symptoms at all. The virus then multiplies over several years, damaging the immune system. Damage can be assessed by counting the number of the immune system cells called CD4 lymphocytes. As the infection progresses, fever, night sweats, diarrhea, and weight loss, swollen lymph nodes, and recurrent infections may occur. In the late stage, known as AIDS, the CD4 count drops very low and various diseases develop, including infections that are not normally serious and otherwise healthy in the people, such as candidiasis, pneumocystis, pneumonia, and cytomegalovirus infection, but may be so in a person with AIDS. There is no vaccine or cure for HIV infection, but antiretroviral drugs can slow the damage to the immune system. HIV budding from a lymphocyte. This micrograph shows clusters of virus particles at the top budding off from the surface of an infected lymphocyte, a type of white blood cell. Polymyalgia rheumatica. This condition is an inflammatory disorder that causes severe stiffness and pain in the muscles of the shoulders, neck, and hips. The stiffness and pain are worse in the morning after waking up, but improve with physical activity. There may also be other symptoms such as tiredness, lack of energy, and a general sense of feeling unwell, fever, night sweats, weight loss, and depression. Polymyalgia rheumatica is most common in those over the age of about 60 and affects more women than men. The underlying cause is unknown, but the condition is thought to be due to a combination of genetic and environmental factors, although specific factors have not yet been identified. In some cases, polymyalgia rheumatica may occur together with giant cell arteritis, a more serious condition in which arteries in the head and scalp become inflamed. Polymyalgia rheumatica is usually treated with corticosteroid drugs. Food allergies Cow's milk allergy. A food allergy is an exaggerated reaction of the immune system to a specific food or food group, causing a range of symptoms from a rash up to abdominal cramps to diarrhea to difficulty breathing or swallowing due to swelling of the lips, mouth, throat, and airways. In extreme cases, it may be life-threatening, cause a life-threatening reaction called anaphylaxis, with sudden breathing difficulty and collapse. Almost any food can cause an allergic reaction, although dairy products, nuts, eggs, seafood, and wheat are common triggers. A food allergy is different from a food intolerance, in which symptoms arise from food toxins, problems with digestive enzymes, or the direct action of chemicals in the food. The most effective treatment for an allergy is to avoid the problem food. People with a severe allergy may be advised to carry with epinephrine auto-injector for emergency treatment. Skin prick testing for allergies. To test for food allergies, extracts of suspect foods are applied to the skin, which is then prickled with a needle. Any redness or swelling at the site of the prick is an indication of an allergy to that food. Lupus. Discoid lupus erythematosus. Wait, let me say that again. Lupus. Discoid lupus erythematosus. DLE. Systemic lupus erythematosus, SLE. Lupus is a type of autoimmune disease in which the immune system attacks the body's own tissues. In lupus, the immune system attacks the connective tissue. This is the material that supports, connects, or binds other tissues or organs, and it occurs throughout the body, in the skin, joints, internal organs, and walls of the blood vessels. For example, the most common type of lupus is discoid lupus erythematosus, DLE, which affects only exposed areas of the skin, such as the face, scalp, or behind the ears. A more serious form, systemic lupus erythematosus, SLE, can affect many tissues and organs, including the skin. In both types, symptoms subside and then recur with varying severity. In DLE, a red, itchy, scaly rash develops. Exposure to sunlight tends to trigger onset of the rash or make the existing rash worse. The rash may leave scars, or if it occurs on the scalp, bald patches. SLE can cause a wide variety of symptoms depending on which parts of the body are affected. A common symptom is a butterfly-shaped rash on the face. Other symptoms may include joint pain, fever, fatigue, weight loss, and mouth ulcers. There may also be other problems such as anemia, kidney failure, inflammation of the membranes around the lungs, or the membrane around the heart. And if the nervous system is affected, headaches, blurred vision, and strokes. There is no cure for either type of lupus, but medication can usually control symptoms. Butterfly rash. A common symptom of systemic lupus erythematosus is a red, raised rash across the nose and cheeks in a distinctive butterfly shape. Alright, we got all of them. Yep.